Right there, it's like a really thick guitar string, like a bass string, and I can just sit on that.
What?
A ninja bit there.
That's, feels like my quad's on fire, man.
Yeah.
Oh, it's
You doing all right?
itchy.
Yeah. Guys, Das Ninja here for another YouTube video. Today we're talking about Pectineus and the TFL and how they can impinge on the hip or cause pain in your upper hip, especially when driving or sitting down if you're at an office job. Yeah, it can become quite short and tight and just painful. So what I'm going to do is get some wax on my hands, warm them up because they're quite cold, and just with a broad stroke, what I like to use is my right hand, using that pisiform, I connect straight onto that ASIS. So that's like the front of the hip bone, you can feel there, and I like to connect in and down on that and then work my stroke in the direction down towards the knee. So it's opening up the hip in a way that we're trying to consider the muscles, the way that they go, and just elongate the tissue. So lengthening of the tissue in essence of muscles that have been short and contracted from sitting, driving, all of that. So how you feeling?
Yeah, it's good, man. You can feel it. It's therapeutic.
Yeah.
Yeah, it's sort of not easy, but you kind of know that it's good.
Yeah.
You're going to be better for it. Oh, shit.
Yep, so I'm working through the quad there all the way down to the knee. I can use my other hand and this time using the inside of the thumb. Same thing, connect on just to a different angle of that ASIS. I can work back into that, so sort of reversing my stroke back into that tendon and then push down. And again, elongate that tissue, those short little muscles in there. We're making sure we're collecting those and just cleaning it out.
Oh, it's good, brother.
Sorry to interrupt your video, guys, but we're just going to advertise our Patreon platform where we post every day, exclusive content, no towels, just us blokes having fun, treating each other. So if you want to see some MMT action every day, jump over there and you will be very happy.
It's good. So this is my warm-up stroke, my palpation stroke. I'm feeling for adhesions, sticky points, muscles that push back at me and feel really tight. And that's where we're really starting to get a good understanding of what's going on. Have you had much hip impingement pain in the past, Ninja, or any at all today? You're pretty good, hey?
Just old corkies and things.
Just old corkies. And
yeah, but it's good for my awareness. And yeah, and I kind of just before too, I didn't even realise I was tensing up, and then I saw I had to relax my leg, and yeah, so it is a challenge getting this stuff.
So what I like to do is use my elbow, and the pectineus, it's a small muscle. It is going to help with the hip flexion of the hip. And I just like to sit in there ever so delicately, but I'm being really particular in where I'm putting my elbow because we do have our lymph nodes down there that are quite sensitive and sore.
Yeah.
So not a lot of pressure to begin with, but just allowing the tissue to relax. And that allows my elbow to get deeper, more connected to the top of the hip bone. And it might not look like much, but you can see by Ninja's expression, this is just gold. Anybody that is feeling that hip impingement pain, or you're just sitting at the desk and feeling like, oh man, I've just got this spot that I need to stretch out. Unfortunately, our hip flexor stretches and things like that, they just don't seem to work nearly as effective as pushing into it. And we've discovered, well, Ninja certainly discovered by doing this style of treatment for almost 25 years. You can probably talk to us about that, but sustained pressure, you know, it's simple, but it's effective, isn't it? Like just holding points and pushing into pain and exploring pain, you become aware of where those receptors are, where those painful points are, and how we can unravel those and melt them down, clean them out.
Yeah, just on that, Das, like, I suppose anybody that's ever received treatment will probably feel that there's some spots that they know are the right spots for them that need to be worked, but people gloss over it, or you just know that, yeah, there's stuff underneath the the surface that people are getting towards, but they need to be held, and you just know in yourself that they need to be held in order to change them. So it's sort of understanding that the fabric of the body, it just needs to be really held in order for it to melt and change. So if you can kind of visualize things that are really solid and they need to melt in order to be able to flow and be flexible, and things like that again, where they're just hardened up and short and painful, and you know, all the nerves are kind of stuck around them. There's the calcium is chunky and hard and spicy. So
solidified in comparison to supple. They're the two ends of the spectrum.
Yep.
Something that's solid and hard compared to something that's soft and supple.
Yep.
We want to melt that solidness into that supple, soft tissue that is obviously going to have a better. You're going to perform better once we can do that. So as the video's been progressing, I've just been changing angles and shimmying my angle of my elbow into different portions of the origin of that muscle. So we know when we're looking for pain in our muscles, one of our main philosophies here is to stick to the origin of the muscle. Where that pain originates is usually the origin of the muscle, the tendon, the attachment site. We just work those, soften them down, maneuver it. Really good. Did you feel like it was more on the inside and hooking in, or what did you feel, Ninja? Is it
the closer you are to those origins, like you were just mentioning before, the more therapeutic that feels. Like it's just where the tension is, and it's where it's loaded. You know, when we're doing activities, so we're moving around, so they're the bits that are loaded, so they're going to be stressed and scarred up, micro tears and things, and become scars.
So the cool thing about my thumb is I've got more of a sense of touch and feel, and right there it's like a really thick guitar string, like a bass string, and I can just sit on that. I'm giving Ninja a bit there.
That's feels like my quad's on fire, man.
Yeah.
It's
You doing all right?
itchy.
Yeah. Yeah. So it's a pretty sensitive spot. It's right around, the sensitive points. So we do have a lot of nerves running down there, and it's not a nice spot to have a thumb pushed into, but it certainly is afterwards.
Yeah.
The release outweighs the pain of the treatment.
Yeah, it's worth it.
It's worth it.
Shit.
Nice. And then TFL, so tensor fascial latte, top of the leg. We like to get into this, don't we, Nidge?
Yeah, top of the effing leg.
Top of the fucking leg. You get into there with an elbow. And again, you've got to work with your client. You can't be too evasive and too broad, digging that elbow right in there. You have to be more delicate with your approach and get in there softly to begin with. Find that point of pain and then work into it. Yeah. This hand here, I can start to get a little bit of a passive release. I've flicked there, which isn't great art.
It's all right though. This can be really painful.
Yeah.
People can feel it right down to the little toe, through the side of the shin.
Yeah. So a TFL is responsible for, again, hip flexion, internal rotation of the hip, but it also attaches into that big, thick connective tissue, iliotibial band, ITB. So instead of trying to maneuver something that's so robust and something that's so thick of our ITB, we can get into the TFL and have an effect on releasing the knee and the hip at the same time. It may not be instant, but as the days go on and our body starts to heal, our body's recalibrating in a way, and our hips and our joints are, sitting in a position that aren't being taut or pulled on by our muscles, so they can sit, they can be more relaxed.
That's good, man.
So treating the tissues, treating the muscles are going to allow the joints to relax.
I'm relaxing now.
You're relaxing now. So probably been a minute in here. We probably don't need to spend too much more than a couple of minutes. For the sake of the video, we're going to come out of there and do just a stroke that goes in and a scoop out. So again, like my first stroke, I'm pushing in, I'm using the broad part of my elbow and scooping out.
Yeah, buddy.
Yeah, mate. Sorry, Nick.
Lightweight.
Lightweight.
Yeah, it's a good.
Yeah, so I've been really effective in helping my clients with hip pain. I do see a lot of active patients who play sport, footy in particular at the moment. You know, me being a footballer myself, a lot of my teammates come in, or I don't know, they're just more attracted to me, aren't they? You sort of attract the person you are. So it's good when I get footballers in. I feel like they're my bread and butter. I feel the most confident in treating.
Yeah, brothers.
Me brothers.
Your tribe. Yeah.
My tribe. That's my tribe. So because I've had a lot of this stuff myself, I know what it feels like. You know, it's cool when I see my teammates going, oh, really don't know if I can play this week. I've got this pain in my hip, and I just know that that's probably just muscle tension and build up. We can actually fix that.
Yeah.
Come in and see me. Get an elbow in your adductor. Get an elbow in the top of the hip. Fixes most people. It's just about teaching the world what's available.
Yeah.
It's out there. You just got to know the right practitioner.
Yeah, it's effective, mate.
Yeah. All right, last one.
Yeah. It's good, man. It feels good.
Yeah. It feels
You know.
good.
Yeah, it's challenging, but you kind of know it's right.
Yeah.
Oh.
Okay. There we go.
Oh.
That's it. Well, I hope you guys learnt yourself something. The Pectineus, the TFL, the quad, how it relates to hip pain. If this video resonates with you, book in online and fix you up.
Get it done.